And as we learn more about yet another school shooting, parents are wondering, how do we talk with our kids about this?
What signs should we be watching out for to know whether they're struggling with this or even worried about it? Jenny Volker is a licensed clinical social worker with Community Fairbanks Behavioral Health, and she's here to help us answer some of those questions. Jenny, thank you so much for being here. One of these questions, so should we bring this up to them or should we wait for them to bring it to us? How do we even start this conversation?
As hard as it is, we've got to start the conversation. And we start by asking, what do you already know? That can really help you. If your child doesn't know anything, maybe that's not the conversation to have right now. But usually they know something. So it's really important to gently clarify any misperceptions.
Especially because a lot's on social media these days.
Absolutely. What are some red flags that we should be looking out for that indicate maybe they're struggling with something mental health related?
Yeah, I usually narrow it down to mood and behaviors. So if we see lots of mood swings, more emotional outbursts than usual, or changes in those normal behaviors, sleep routines, eating routines. For teens, it may be changes in using substances or alcohol. For younger children, it could be regressing back to earlier behaviors such as tantrums or even clinginess.
And so how should we angle that support, or what should we be doing to support them?
Yeah, parents are the experts on their own kids. So if they're seeing these changes and they're really kind of extreme for their child, they should reach out. Even if they're not sure, if you're questioning it, that's the time to talk with the school, talk to the pediatrician or your local community mental health center.
And what should we do if we think our child may need some professional support, more than what we can provide them?
Yeah, you've got a couple of options. If it's immediate professional support, there's 988. That is the National Crisis Lifeline, available 24/7. But also, again, reaching out to a local community mental health center or behavioral health, or even your family doctor.
Okay, all right. Jenny Volker here to help parents, help folks figure it out. We appreciate you. She is with Community Fairbanks Behavioral Health. Appreciate you for being here.
Tough conversation, but appreciate it.
Thank you.